this video we will do the similar massage techniques now for the anterior thigh. So again, these techniques I'll be using some oil, and we'll just tuck that towel out of the way, or tuck the shorts out of the way with a small towel. So, effleurage to begin. Ideally, if we can get effleurage all the way up to the anterior superior iliac spine, so I might have to just let my patient know I'm going to do the draping up that high. If not, I mean, you're just going to get to quads and the anterior thigh as best as possible. On your effleurage stroke, make sure again that you are including all aspects of the thigh, lateral, anterior, and medial, and just like we talked about with the posterior thigh, respecting that boundary. If by chance I wanted to do a lot of adductor work for on this patient, what I would have them do, I'm just going to have you do this, Abby, is I would have them set up the boundary here and hold their hand there, so again we could be sure that a boundary was being respected. But we won't show that. That's a little bit more detailed work in this basic course. Okay, so that's effleurage with the hands. We can do effleurage with the forearm. Again, I tend to slow it down just a little bit because it's a broader stroke and it's pretty easy to get a bit too deep, yep, a little bit too quickly. Sorry about that. You can also do fists. This table height's a little bit too high for me, so again, my mechanics on my wrist aren't going to be as good as they should be. Ideally, this would be a little bit lower for me to do fists. So already I can feel that the person I'm working on has quite a bit of tightness on the lateral thigh, and they're not disagreeing. All right, palmar kneading is next. And certainly the kneading, as always, has a circular component to it. Fingertip kneading could also be included. Adductor muscles can typically be, again, kind of sensitive or ticklish, so we want to monitor how that's doing for your patient. Some open C's here anteriorly, here medially. I'll slow that down a little bit. Adductor work is really important to do. So don't shy away from it in that way. And then laterally, again, I've just come down very low into like a sumo squat to get as lateral as I can on those open C's. Compression work. So all the same types of strokes. I'm doing anterior thigh here with the palm. I'm going to do some fingertips on the more medial aspect of the thigh. And certainly laterally. I'll show laterally here. I might use thumbs more, but we'll just show laterally with the fingertips here. So just up the IT band. That's obviously rather uncomfortable on the tight IT band, so go carefully. And ticklish, okay. And then ringing we can do next. So hopefully you're seeing that this is a very basic pattern that can be followed for these techniques. And certainly the tools can be modified, a number of them, to fists and knuckles and whatnot. Okay, the next stroke that I'm going to do, Abby, I'm just going to take the pillow away, and if you wouldn't mind bending your knees up, please. Thank you. Okay. So we're going to do 2 strokes. This leg I'm going to have you straighten out. So just get that out of the way. And I'll show it on this side just so it's easier to see. I'm going to tip her towards me. Now she does have a little bit of a bruise there, so I wouldn't want to put a lot of pressure there. But this is where we're going to do more of a myofascial technique, and I'll try to stay away from that. Let me know if something comes out. Don't do it anymore. So I'm going to use the ulnar border, and I'm going to put some pressure downwards. And the nice thing about doing this myofascial technique here is that you can add, if this person was tight, which she's really not in this hip area, is you could add a stretch coming across. I'll relax my wrist on that one. Is the pressure okay? Yeah. So again, nice and slow as able here. I have a little bit of oil on my arm, so I am gliding a little bit more than I am getting in deeper, but that's okay. It'll just show you the technique itself. I've just repositioned my body because I was kind of starting to get in contact with her knee. So as the therapist, you might need to just kind of decide which arm is my better arm. And in fact, for me, this probably would have been my better arm to do, just so that I'm not hanging out on her knee with my chest. Good. Alternately, you could do a fist. Again, you'd want to watch your mechanics. This probably isn't the best position to do it in. You might do it from this side. We'll just change legs up. Bend this one up. So from this side, then I can get my mechanics a little bit better. I'll just show it up. This would not be the speed you would use, but I'll just show the positioning here. Okay? All right. So the last one that we'll do is some work on the hamstrings from this position. So I'm going to plunk your, I was going to say your elbow, but your ankle on my shoulder. My other hand will be in front, and my elbow or my forearm is now going to apply some pressure to hamstrings. So this is a really nice position to do a myofascial release on hamstrings, because I can do two things. I can bring the hip into more flexion, which for some people will be a hamstring stretch increase, or I can bring my body upward, which would again extend the knee, which will add more stretch to the hamstrings. So nice and slow, moderate pressure. Pressure's okay. A couple tight spots in there, hey, but not too bad. Okay. So nice and slow through the hamstrings there. And as always on all of these myofascial things, you want to slow down, exit gracefully, and you can do a few different lines, more medial, more posterior, more lateral. Okay? And that is the anterior thigh, and posterior for that matter.